Morning guys, I am Z and Ziluntiam, and today as our group we're going to discuss about ALL. The previous group they already discussed about AML. This is almost the same with AML. The difference between of them is ALL is white blood cell and AML is red blood cells. ALL is we also call that acute lymphoblastic leukemia or acute lymphocytic leukemias. It is a cancer of the blood and bone marrow. Acute lymphocytic leukemia is blood cells, white blood cells, lymphocytes or lymphoblasts. There's too many immature white blood cells crop in the bone marrow, and so the bone marrow cannot prevent or fight infections. This is most common leukemia in children, less common in adults. And now let's proceed to our patients. Our patient is 3 years old, male client, and he's a Catholic and he's a Filipino, and he was born on February 20, 2016, and he lived in Balanya City, Batan, and he was admitted to the hospital on February 12, 2020. And significant others are his father and mother and his eldest brother. And his chief complaint is swelling left upper and lower quadrant, and his diagnosis is acute lymphocytic leukemia. And now let's proceed to history of present illness. 2 months prior to admissions, the patient's mother noticed that her son to have swelling of left upper quadrant, and there's no tender, and the patient doesn't have fever, and with easy fatiguability and easy breathing, and there's no consult done and no medication taken. And 1 month prior to admission, the patient consulted due to gradually enlarging mass extending to the left lower quadrant. There's non-tender and with jaundice, and patient doesn't have fever, and with easy fatiguability and easy breathing. Attending physician advised ultrasound, which revealed splenomegaly, and was referred to hema-oncologist. And 3 weeks prior to admission, the patient consulted at hema-oncologist, and bone marrow results revealed 50.41% blast, and he was diagnosed with acute lymphocytic leukemia, and the doctor scheduled for the chemotherapy. For medical history, the patient mother said that the patient mother said that her son doesn't have any history of surgeries or hospitalizations before. This is his first time admitting in the hospital, and the patient already complete all of his immunizations, and he doesn't have any allergies. Family history. As we look at family history, patient's mother has positive with ecoleusis and pneumonia, and his father has positive with arthritis, and mother's side has cervical cancer, and uncle brother of his mother has leukemia, and father's side of grandmother has diabetes and hypertension, and grandfather, father side has arthritis. And thank you.
So my name is Carl Andriti Manipon, and I'm going to talk about the anatomy and physiology of our report. So first, inside the hollow area of the bones is a spongy core called bone marrow, and it is here that stem cells are produced. Stem cells are immature cells that can develop into components of blood. First, the red blood cells, which carry oxygen to the body, and white blood cells or lymphocytes, which fight infections. And lastly, platelets, which helps blood to clot. So acute lymphocytic leukemia, or ALL, is a cancer of stem cells in the bone marrow that produces lymphocytes. So the term acute means the cancer cells multiply rapidly, crowding out the normal cells in the blood and bone marrow. In addition, as the number of unhealthy lymphocytes in the blood and bone marrow increases, fewer red blood cells and platelets are produced. So if the bone marrow is unable to produce enough healthy lymphocytes, the patient will be unable to fight infections. So the leukemia cells can travel in the bloodstream or metastasizes to other organs in the body where they can begin to form additional tumors. So we'll talk about hematopoietic stem cell. Hematopoietic stem cells are pluripotent, meaning that they can be raised to myoblasts, which is a precursor of myeloid, and lymphoblasts, which is a precursor of lymphoid cell. So we will talk more about lymphoblasts. So these lymphoblasts can be a pre-B cells, which develops into B lymphocytes, or a pre-T cells that develops into T lymphocytes. As I said earlier, erythrocyte or red blood cells carries oxygen from the body, while platelets or thrombocytes helps blood to clot, and leukocyte or white blood cells helps us from infection. So white blood cells like granulocytes and monocytes helps us protect from the infection. So granulocytes are cells like with tiny granules inside of them. It can be neutrophil, which approximately 40% to 60% of white blood cells in our body, eosinophil, and basophil. So if a hematopoietic stem cell develops into lymphoid cells, on the other hand, it will mature into some kind of leukocyte, a T cell and a B cell, or a natural killer cell which referred as lymphocyte. And that's all. Thank you.
So hi everyone, I'm Trisha Ligaspi and I'll be talking about the pathophysiology of the ALL or acute lymphocytic or lymphoblastic leukemia. Start po with our pathophysiology. ALL or acute lymphocytic or lymphoblastic leukemia. Actually, the etiology is unknown, but here are the two factors, predisposing and precipitating factors that can affect the client. Predisposing factor are those that put a child at risk of developing a problem. The precipitating factor refers to a specific event or triggers to the onset of the current problem. So these are the difference of these two. For the predisposing factor, age, which is 3 to 5 years old, the patient is 4 years old. So pasok. Gender, male, still unknown. Why? Why they are more prone than female. Race, family history. So the uncle is diagnosed of leukemia but undergoing date. So for the precipitating factor refers to the specific event or triggers the onset of the current problem. The patient was exposed to chemical when he was 1 year old, based from the mother. Being exposed to X-ray before birth as treatment with chemotherapy or genetic abnormalities such as Down syndrome. So first, somatic mutation in DNA, it actually occurs right after the conception. So for the malignant transformation of lymphoid stem cells, actually acute lymphocytic or lymphoblastic leukemia is a type of cancer in which is a type of bone marrow cancer of which there is a immature or overgrowth of these immature cells or the lymphocytes. Just like what Carl says with his anatomy, lymphocytes can be classified into three, right? B lymphocytes, T lymphocytes, and NK are the natural killer cells. Uncontrolled, there is a uncontrolled proliferation of these lymphoblasts or these blast cells that actually in a healthy child they produce blood stem cells or these hemopoietic, how do you call it, hemopoietic stem cells or the immature cells, but suddenly in due time they become mature cells. But with the ALL, they there is a increasing numbers of these immature cells, but they don't become mature cells. So for the transsomal translocation of abnormalities of chromosome number, actually the chromosome number 9 and 22 rather, they interchange. And also the chromosome 9 and 22 they interchange, and also the number 12 and 21, 9 and 22 they interchange, and 12 and 21 it interchange. So why? So ano naman if they interchange, so now they actually um they actually affects the cell production, and it affects the cell function. It affects the cell function and cell division. Kasi nga, they produce more of these immature cells. So for the lymphoblasts, replace the normal mature elements, yes, through a diagnostic test, BM aspiration, and BM biopsy. So the patient have his BM biopsy last January 7, 2020, but sadly, because of this pandemic, we actually have a plan to go back to the AMCM last Sunday that before the lockdown. But because of this pandemic, we don't have the chance to go back to the AMCM. So with the treatment, remission, induction therapy, consolidation maintenance therapy, and BM transplantation. Actually, if the patient um, does not um, does not acquire a good prognosis with the treatment of this reduction therapy and consolidation, BM transplantation is recommended. Um, the patient have his remission induction therapy. Actually, this treatment is also the chemotherapy itself. So why remission induction therapy? Actually, this is the first phase of the treatment. The goal is to kill the leukemia cells because there is now the increasing number of immature cells. So the goal of this remission induction is to decrease the number of these immature cells. Next, due to the amount of there is now a decreased production of normal cells. Yes, that can lead to leukopenia, which means the decreased number of healthy white blood cells. So the patient manifested this sign through the diagnostic test of CBC last February 5, 2020. Um, the result is 4.40, but the normal range is 5 to 13. Yeah. So if there is a leukopenia, which is the decrease of number of healthy white blood cells, we all know that white blood cells used to fight infection. Now, due to there is a decreased number, infection occurs. If not treated, septicemia or worst case, death. Spillage of lymphoblasts into the bloodstream, yes, because there is now a increasing number of these immature cells. Oh, sorry, I forgot. So having this decreased production of normal cells, now there is a some sign and symptoms of fatigue, bruise and bleeding, anemia, fatigue, dizziness, palpitation, dyspnea. So the patient manifested bruise, fatigue, and dyspnea last December 2019 because that was the time when the mother was actually observed his child that he has bruises, easily no fatigue. Now, as the amount of these blast cells in the bone marrow keeps increasing its spill into the blood, these lymphocytes actually go to the certain body parts. So first, in the kidneys, now there is now a renal failure. Actually, um, according to Luciano and Brewster, sorry, these two are physicians. So the kidney involvement in this leukemia is actually quite extensive. So we can see if the patient has now the renal failure, he has the sign and symptoms of little to no urine output, increased RR, flank pain, restless, nausea and vomiting, legs, and feet swelling, uremia, azotemia. So there. Now, with the CNS, can be affirmed through MRI. Um, CNS, actually, this leukemia can spread in the CNS. Leukemia cells may build up in the cerebrospinal fluid surrounding the spine and the brain, or it may take up onto the brain itself. Actually, when it spreads, when the leukemia spreads in the brain, the patient can experience this weakness, blurred vision, facial numbness, headache, lethargy, which the patient manifested weakness and lethargy last December. Um, Now there is a treatment called intrathecal chemotherapy, just like what remission remission induction therapy. That is the intrathecal chemotherapy. Why? Why intrathecal chemotherapy? Because this therapy are given to prevent or to treat the spreading of leukemia cells to the brain, to the spinal cord. Because these leukemia cells can progress to seizure or to coma or worst case death. Yes. So just like what I said, as these blood cells continue increasing, sometimes it goes to the liver or in the spleen through a ultrasonography test. Actually, because of the enlargement of this organ, extra cells cause the liver spleen to rupture that goes to bleeding or hypovolemic shock. The patient has splenomegaly last January, January 16, 2020 through the ultrasonography test. But now, the patient is okay. Wala na po siyang splenomegaly. There, I think I said everything. With now, Actually, they are interconnected because it talks about the enlargement of the certain organ. Now, overgrown of thymus. Why? Where is thymus? It is located at the upper part of the heart, right? So now there is a compress of the superior vena cava that goes to CVC syndrome. Why? Now there is a enlargement of thymus, right, located at the upper part of the heart, which now the heart SBC or the superior vena cava is located at the superior part of the heart, right? So now there is a compression. Why? CVC having the swelling, CVC syndrome, having a swelling of the head, neck, and the arm, and also the obstruction of the blood flow. Why? CVC is the major part or major vein in our body. It carries what? The blood from the head, from the neck, from the upper chest, and the arms. So now, hindi na maka-flow. So there is a obstruction of blood flow, swelling of the head, the neck, having now the shortness of breath, their cough or suffocation. Worst case, death. Okay. Sana po medyo I explained it well. So with the lymph nodes, now through lymph node biopsy, there is a mediastinal lymphadenopathy, which is where here again, thymus, mediastinal in the middle. It is located in the middle part. Okay, mediastinum area located between the what? The lungs, the heart, the esophagus, the trachea, nandun lahat, diba? Mediastinal lymphadenopathy, which means there is a enlargement of the nodes there. So, now, there is a bronchial tracheal obstruction. Why? Kasi nga nandun eh. It is located there. The bronchioles and the trachea, the lungs is located there. So now, merong enlargement of the organ. Esophageal compression. Esophageal impression having dysphagia or difficulty in swallowing kasi diba enlargement, erosion of the nodes into the bronchioles, trachea, having a hemoptysis or yung nagkakaf ng blood or severe hypoxia kasi nga there is an enlargement, nandun na yung bacteria, so yeah, the worst case, death. So everything is interconnected. Once na if not treated, it can lead to death. But here are the organs actually affects or the one may cause why the organ failure is because of the leukemia or the production of these not healthy white blood cells. So I hope I did and you do understand how this works. So good day everyone. Thank you.
So, hi everyone, my name is Aliyah Umari and today I'm going to report about the prognosis of patients with acute lymphocytic leukemia. So, there are many factors affecting the prognosis for acute lymphocytic leukemia. The prognosis for patients with ALL is good and the survival rate is at a high rate. And there are 95% of patients with ALL, according to reports, that are expected to have a good response after the completion of treatment. So, children who are between the ages of 1 and 9 with B-cell ALL tend to have better cure rates. And children younger than 1 year old and children that are 10 years or older are considered high-risk patients. Adults, on the other hand, have a lower rate of prognosis because they are more likely to experience a more severe variation of acute lymphocytic leukemia. And unlike children, adults only have a remission rate of 60 to 80% and 35 to 40% survival for more than 2 years after receiving aggressive treatments. On the other hand, older people may also have other health conditions that make it difficult for them to cope with the side effects of treatments for ALL. And those who are younger than 50 years of age, they have more favorable prognosis than older adults.
Hello everyone, I'm Frendel Ikadalig and I'll be discussing to you the problem number 1 and number 3 of the nursing care plan of our patient. Aliyah and I divided our parts in problem number 3 to equally distribute our parts. So let's start. Our first problem is the pain at the lower back of the patient due to the intrathecal chemotherapy that had been administered through lumbar puncture. In assessing the patient, the subjective cues that we gathered is the 3 out of 5 of faces pain scale, and objective cues are the facial grimacing, crying, and HR and NRR is above normal, which are all signs of pain. Our nursing diagnosis is acute pain related to anti-leukemic treatments, secondary to intrathecal chemotherapy, as evidenced by facial grimacing. In our patient's case, intrathecal chemotherapy was administered through lumbar puncture, which is a procedure that needs a needle inserted in the lumbar area and may cause after pains, and that pain should settle in 48 hours. In planning, our NOC is pain level because we want our patient's pain level decrease or be eliminated. Our short-term goal is after 6 hours of nursing intervention, the patient will be able to demonstrate behaviors to manage pain. Health teaching is important because it helps the child cope efficiently in managing the pain. Our long-term goal is after 2 days of nursing intervention, the patient faces pain scale will decrease from 3 out of 5 to 0 out of 5, as evidenced by HR and RR will be within normal range. Since the pain caused by intrathecal chemotherapy is settled in 48 hours, the pain should have subsided by then. Let's go to our nursing interventions. Our NIC is pain management because we want to alleviate or reduce the pain to a level of comfort acceptable to the patient. Independent interventions include monitoring vital signs, note nonverbal cues, muscle tension, restlessness, because it may be useful in evaluating verbal comments and effectiveness of intervention. Providing quiet environment and reduce stressful stimuli, limit or reduce noise, lighting, and constant interruptions, because it promotes rest and enhance coping abilities. Next is encourage use of stress management techniques. Teach relaxation and deep breathing exercises, guided imagery, visualization, because it facilitates relaxation, augments pharmacological therapy, and enhances coping abilities. Next is providing rest periods to promote relief, sleep, and relaxation, because one's experience of pain may become exaggerated as a result of exhaustion. Pain may result in fatigue, which may result in exaggerated pain. A peaceful and quiet environment may facilitate rest. Dependent nursing intervention. Dexamethasone 10 mg per M2 for 20 days. In our patient, this is prescribed because it is used to treat blood or hormone or immune system disorders like ALL, and because dexamethasone is the most commonly prescribed corticosteroid for pain. Evaluation. In short-term goal was met. After 6 hours of nursing intervention, the patient was able to demonstrate behaviors to manage pain, and because of the help of his supportive mother as well. Long-term goal was met. After 2 days of nursing intervention, the patient faces pain scale was decreased from 3 out of 5 to 0 out of 5 as evidenced by HR and RR was within normal range, and also since he was able to sleep well.
This is Aliyah Rizal Omani, and now I'm going to discuss the second problem of our patient, which is body weakness. So my report for today is the nursing process, which includes the assessment, the nursing diagnosis, the planning and intervention, and evaluation. For our assessment, under our subjective cues, the mother of our patient verbalized tuwing may ginagawa siya, sobrang bilis niyang mapagod at nakakaramdam siya ng panghihina. Under our objective cues, we have noticed that our client is weak in appearance, and after monitoring the vital signs, the respiratory rate is 37 breaths per minute when the normal range should be 20 to 30 breaths per minute. The pulse rate is 127 beats per minute when the normal range is 70 to 120 beats per minute. And the hematology test results showed that the RBC is at 4.17 when the normal range is 4.50 to 4.80. The nursing diagnosis is activity intolerance related to imbalance between oxygen demand and supply secondary to anemia. So we all know that if the patient is anemic or if he or she has a low red blood cell count, then he or she may experience easy fatigability and weakness. So for the case of our patient, after we have monitored the hematology test, it showed that the red blood cell is lower than the normal range. So when a person has a lower red blood cell count than normal, their body has to work harder to get enough oxygen to the cells. And a low red blood cell count can cause a variety of symptoms and health complications. For our planning and our nursing outcome classification, it is endurance. It is endurance because our goal is for our client to maintain activity level within capabilities. And also, the mother of our patient told us that his son is always experiencing easy fatigability and weakness during his activities. Our short-term goal is after 30 minutes of nursing interventions, the client will be able to identify measures to decrease activity intolerance. So health teaching is really important as part of our nursing interventions to meet our goal. Our long-term goal is after 2 days of nursing interventions, the client will be able to maintain activity level within capabilities as evidenced by normal vital signs during activity and absence of weakness and fatigability. For our nursing interventions, our nursing intervention classification is self-care assistance, IATF. And the dependent intervention, the first one is we have monitored the vital signs. So we have monitored the temperature, the pulse rate, and the respiratory rate. And as we have noticed that the pulse rate and the respiratory rate is usually above the normal range. So according to some studies, tachycardia may occur because of the causes during the treatment of leukemia. And also, the body should compensate and the heart should work harder in order for it to provide and pump oxygen to the tissues of the body. And also some manifestations such as cardiopulmonary manifestations may result from attempts by the heart and lungs to supply adequate amounts of oxygen to the tissues. The second one is we have assessed the patient's ability to perform the activities of the daily livings. So this is important because it may influence the choice of the intervention that we have to give for our patient and the needed assistance for our patient. The third one is we have provided a quiet environment and uninterrupted rest periods. So this also helped our patient restore the energy that he needs for activity and for cellular regeneration and tissue healing. So doing this and lessening any interruptions will help our patient to rest and benefit from sleep until anemia is resolved. We have also recommended small, nutritious, high-protein meals and snacks. So we have recommended nutritious foods such as fruits like bananas, peaches, strawberries, and oranges, and also high-protein meals such as fishes because smaller meals require less energy for digestion than larger meals. And if our patient has an increased intake, it provides him fuel for energy. We also provided teaching about energy-saving techniques such as sitting rather than standing and use of shower chair. So this method will help our patient to maximize available energy for self-care tasks. And we also provided teaching for the family and for the mother of the patient, because the mother is the main caregiver of the patient. For our dependent nursing intervention, we have monitored laboratory test results such as hemoglobin, hematocrit, and red blood cells. So this is important because it helped us identify the deficiencies in RBC components affecting oxygen transport, treatment needs, and response to therapy. So our evaluation, our short-term goal is goal met. After 30 minutes of nursing interventions, the client identified measures to decrease activity intolerance. Our long-term goal is goal met. After 2 days of nursing interventions, the client was able to maintain activity level within capabilities as evidenced by normal vital signs during activity and absence of weakness and fatigability. Now we're going to move on to the third problem of our patient, which is weakened immune defenses. And it will also include the assessment, nursing diagnosis, planning and intervention, and evaluation. So for this, I'm going to report about the nursing assessment. Under our subjective cues, the patient's mother verbalized mabilis siyang mapagod at nakakaramdam siya ng panghihina. The patient is also diagnosed with acute lymphoblastic leukemia. Under our objective cues, the hematology finding results showed that the white blood cell count is at 4.40 when the normal range is 5.00 to 10.00. Segmenters is at 34 when the normal range is 43 to 64.
This is Frendel A. Kadalig speaking, and I will continue discussing the next part to you. Our nursing diagnosis is risk for infection related to inadequate secondary defenses, alteration of mature WBCs. Since our patient is diagnosed with ALL, his immune system weakens and is less able to fight infection, making him vulnerable for infection. In planning, our NOC is knowledge, infection control, because we want him to learn how to lessen the risk for infection. Short term, after 1 hour of nursing care, the client will be able to identify behaviors and practices to prevent and reduce risk for infection. Since our patient is 4 years old, we make sure to it that our health teaching is simple that he can understand, like showing him how to properly wash hands. Long term, after 8 hours of nursing intervention, the client will remain free of infection, as evidenced by normal vital signs and absence of signs and symptoms of infection. Our NIC is infection control. Independent nursing intervention includes wash hands and teach how to wash by encouraging the patient to do the same. Dry hands with a paper towel after washing, because hand washing is an effective technique to prevent the spread of infection. Dry surfaces are better in preventing the transfer of microorganisms. Encourage adequate rest, because adequate rest can reduce stress and boost the immune system. Next is encourage patient to eat a balanced diet, because a balanced diet intake of omega-3 and omega-6 fatty acids, protein, vitamins A, C, and E, zinc, and iron is essential in reducing the risk of infection. Next is limit visitors, because restricting visitation reduces the transmission of pathogens. Our dependent nursing intervention is administer medications as indicated, cotrimoxazole 5 ml, MWF 2 times for 8 weeks, because cotrimoxazole is a combination of trimethoprim and sulfametazole and is in a class of medications called sulfonamides. It works by stopping the growth of bacteria. Our evaluation is, in short-term goal was met. After 4 hours of nursing intervention, the client was able to identify behaviors and practices to prevent and reduce risk of infection, with of course the help of the mother. Long-term goal is goal met. After 2 days of nursing intervention, the client remains free of infection, as evidenced by normal vital signs and absence of signs and symptoms of infection.